Hello everyone, I'm Dr. Moon from Korea. Today it's a pleasure to discussing the clinical applications of PRP, platelet-rich plasma, treatment in relation to adolescent sports injuries. The use of PRP therapy has been increasingly popular in the sports medicine community due to its unique ability to restore healing potential in damaged tissue. Medial epicondylitis and ulnar collateral ligament injuries are common among athletes who frequently perform throwing motions, like baseball and cricket players. These injuries typically occur from overuse, specifically the repetitive strain on the elbow joint during the throwing motion. The UCL is a ligament on the inner side of your elbow that connects your upper arm to your lower arm. It's crucial in stabilizing the elbow during throwing motions. Injuries to the UCL can range from minor damage and inflammation to a complete tear of the ligament. In the context of throwing athletes, chronic ulnar collateral ligament (UCL) injury or weakness can indeed contribute to the development of OCD, particularly in the elbow. This is often the result of the repetitive and intense stress placed on the elbow joint during the throwing motion. This stress can disrupt the blood flow to the bone and lead to the development of OCD. The test for medial epicondyle lesion is performed to determine whether the structures are injured. 1. The examiner then applies pressure to the palm, asking the patient to flex the wrist against this resistance. 2. If the patient experiences pain on the inner side of the elbow during this movement, it could indicate medial epicondyle lesion. PRP is obtained by centrifugation. Centrifugation is a process that uses centrifugal force to separate the platelets from the rest of the blood. Platelet-rich plasma, PRP, is rich in various growth factors that have the potential to enhance tissue healing. These growth factors include 1. TGF-beta 1. This growth factor helps regulate cell growth, proliferation, and differentiation. It plays an important role in wound healing. 2. PDGF. PDGF stimulates cell replication, angiogenesis, the formation of new blood vessels, and collagen synthesis, all of which are crucial for wound healing. 3. BFGF stimulates the growth of fibroblasts, which are cells that produce collagen and other structural fibers in tissues. It also promotes angiogenesis. 4. VEGF significantly promotes angiogenesis, aiding in the formation of new blood vessels, which is a key factor in the healing process. 5. IGF stimulates cellular proliferation and differentiation, especially in skeletal muscle, cartilage, and bone. These growth factors together create a more conducive environment for healing, potentially accelerating the repair process of damaged tissues. The 14-year-old baseball pitcher has a MCL injury with a bony avulsion. A positive valgus stress test indeed suggests an injury to the ulnar collateral ligament, UCL, also known as the medial collateral ligament of the elbow. The point of injection for the medial epicondyle and the ulnar collateral ligament is typically guided by ultrasound to ensure accuracy. Absolutely, rehabilitation after a PRP injection is very important. PRP therapy can initiate a healing response, but the healing process needs to be supported with appropriate rehabilitation to ensure the best outcome. Wrist extensor stretch. Stand or sit with your arm extended in front of you, palm facing down. With your other hand, gently bend your wrist downwards, so your fingers point towards the ground. Hold this stretch for 15 to 30 seconds, then release. Repeat 3 to 5 times on each side. Wrist flexor stretch. Holding your right arm straight out in front of you. The palms of your hands should face outwards. Take your left hand, hold the fingers of your right hand and bend them backward. You should feel the stretch on the inside of your right forearm. Hold this stretch for 15 to 30 seconds, then release. Repeat 3 to 5 times on each side. Strengthening exercises for ulnar deviation can help to improve wrist stability and function. Wrist flexor exercises can help strengthen the muscles that control the movement of bending the wrist forward, towards the palm. My cases were 8 adolescent players between the ages of 14 and 18. The male-to-female ratio was 7:1. They underwent PRP injections and were evaluated over a period of 6 months. Prior to the procedure, the VS, Visual Analog Scale, scores were 8.3 before the injection and 3.0 after the practice, indicating significant improvement. Additionally, the Mayo Functional Assessment scores were 15.6 before the procedure and 84.4 after the procedure, demonstrating excellent results and enabling early return to sports activities. Yes, we found that PRP treatment for elbow injuries in adolescent sports players can help to reduce pain, improve range of motion, and speed up the recovery process. In conclusion, it is safe and effective treatment for ligament injuries in youth athletes.